Hi, welcome to ThinkVisual. I'm Linda Ravenhill from VisualLive, and I'll be your host for today's session. In these monthly vlogs, we're going to be looking at the role of new media in business, particularly with the African context in mind, looking at how it's employed in our communications and in our e-learning. For today's session, we thought we'd take a look at the explosion of new media in healthcare and what that means for us, particularly around the legal implications of this explosion. So with me in studio, I've got Neil Kirby from Workman's Attorneys in Johannesburg. Thanks for joining us, Neil.
Thanks for having me.
Neil, I'm going to dive straight in here and say to you, well, the mobile health market is anticipated to be worth $27 billion within the next 2 years, which is huge. I probably think that's underestimated.
Sure.
So I think what's really interesting about that environment is that it's completely unregulated. If you look in the States, the FDA had their draft regulations out about 2 years ago, and they're reviewing them in Congress now. But it seems to be a very fluid market. What's your understanding of how we're going to look at regulating this in the South African context? And indeed, do you actually think it's possible to regulate it?
I think it is possible. I suppose that's the short answer. And it's a pretty easy one to give because ultimately we don't know how to do it yet. What will have to happen is that regulation will have to occur. I think when you combine new media and healthcare, there is far more likelihood of something going wrong, and if it does go wrong, it'll go wrong spectacularly. So regulation, I think, is definitely going to occur. When it's going to occur, I don't know, and what it'll look like, I don't know. We might be seeing the beginning of that regulation in the form of what we currently have as the Protection of Personal Information Bill. Right. But that doesn't go as far as regulating how healthcare information, for example, moves through a new media platform. So we don't yet have an idea of what that would look like. There are indications from the Department of Health that they would very much like to exploit e-technologies for purposes of healthcare delivery. But once again, it's all very nascent. We don't quite know what that's going to look like from a legal or a regulatory perspective.
Okay, because the Department of Health do have their e-strategy, their e-health strategy document.
They do have an e-health strategy document. It makes for interesting reading. It does indicate a willingness to incorporate electronic media into a healthcare delivery system. It presupposes that that kind of delivery is reliable and that it is sought after and accessible. I'm not sure that all of those prerequisites necessarily exist in South Africa, bearing in mind that the emphasis really needs to be on the delivery of healthcare in the rural areas.
So let's pick up on something that you said around the protection of information. Given that it is so unregulated and there's this whole question around where is your data being kept and who has control of that, how do you see that playing out? How do you see that being enforceable really in this market?
Well, I think to a large degree, self-regulation is going to play a role. I think that because it's a consumable, people are able to consume healthcare on phones or on email or on laptops or on devices that are becoming increasingly mobile, increasingly accessible. I think you're going to find that very much like any other form of healthcare, the good stuff is going to survive and the bad stuff might very well fall away. But that's going to take a long time to get to that point, because at this stage there's a lot of everything out there, and consumers would need to be very careful about what it is that they rely on or what it is that they access, because there's no real guarantee that it's reliable or that it's credible. So that is a big problem when it comes to how to discern the two, because it is healthcare information, it needs to be accurate. Whether or not it's going to be only a matter of self-regulation, I would think is a matter of speculation. I think we are going to see a black and white system of law that's going to be implemented in order to ensure that we're able to tell the difference. Who will ultimately have the authority to decide that? I don't know. The Americans are talking about the Food and Drug Administration.
That's right.
Our equivalent is the Medicines Control Council. Well, the Medicines Act doesn't yet contain that type of power that the Medicines Control Council would be able to verify, for example, a credible app or reliable healthcare information on the internet. The Consumer Protection Act might take that forward. I don't know. But it may be a combination of various statutes that would need to be looked at very carefully to see if they could cope with the change in the dissemination of healthcare information.
Because I think that's spot on. I think even if you look at the FDA, the total number of regulated apps is only 87. Out of that entire industry, they've only actually looked at those, and those fall within their food and drug, that actual medicines prescribing side, and there's the whole device industry that no one's even looked at. So I'd like to pick up on the point that you said about how do we know as consumers, or how do we know even as companies, what are good and what are bad technologies? So I know that we were discussing earlier one of the apps that have come out that was reviewed in the JAMA article around being able to diagnose melanomas. So I think my question is, who bears responsibility in a legal context for those apps and for the information that goes on there? Is it the company who puts out the app? Is it the developer who's developing it? Or is it the consumer or the healthcare practitioner who's using the app? How do you
divvy up that liability? It's an interesting question, because I think that there is quite a bit involved for all of the parties you've mentioned. I think the consumer probably would be the person who's the most vulnerable, because they would normally rely on the app to contain information that is correct, accurate, credible, because it appears to be part of this e-culture, that what you see on your tablet or device or your laptop on the internet is just automatically credible. And it's not. You have to be very careful about what it is that you're looking at and relying on. I mean, obviously, if you're looking at the weather in London, then that's fine. But if you're talking about something along the lines of how to diagnose a melanoma, well, that's a little bit different. So you as the consumer would have to apply a bit of savvy, I think, and make sure that you don't rely necessarily on what is happening on a photograph. I don't think that anyone reasonably expects a proper diagnosis to be made off a photograph. But then again, anyone who puts out information or makes a representation, at least in terms of South African law, that something can do something when it can't, is going to be subject to penalty as well. And at least in the Consumer Protection Act, such issues arise. Whether or not you find someone who is making a representation that they're able to provide medical advice, because fundamentally it may very well be a diagnosis, the person who is publishing or making that app available may very well fall foul of healthcare legislation, in which event they might then run into liability.
So I, as a developer, would bear the responsibility for that?
You may very well be, and not only the responsibility for what has happened if somebody incurs harm, but also what are you doing? Are you making an app available that fundamentally replaces the advice of a specialist or a doctor, in which event you might then be performing an act that is otherwise regulated, and you might find yourself in a bit of regulatory trouble. So one needs to be very careful about what it is that you're doing with apps, and especially with medical advice, no matter where you are broadcasting it from. If it finds relevance in South Africa, there may be consequences in this jurisdiction.
I guess it's just common sense.
I think to a large degree you've got to, I mean, the Consumer Protection Act does talk about it. It doesn't say, well, consumers are vulnerable and stupid. It says, look, you've got to be careful. You, the consumer, you need to take responsibility as well. Don't be naive. Don't succumb merely to what it is that's happening on the internet because it's happening on the internet, or that it's happening on some sort of device that you believe is flashy enough to be credible. You've got to be careful yourself.
So Neil, just to pick up then again on what you've just said, in the States there was a study done this year called the Canton Media Survey, and they looked at physicians who were using their smart tablets for professional purposes. 74% of those physicians said they used them for prescribing information, calculating dosages, etc. But 31% of them indicated that they made their prescribing decisions solely off their smartphones. Now, that's a very scary statistic.
I suppose it is a scary statistic. I think one's got to be careful about necessarily prejudging the information that is available. Fundamentally, though, the obligation rests on the doctor or the physician to understand that the information is correct. So they are in a position where they are able to discern, because of their professional experience, professional qualifications, what is rubbish and what is reliable. And to a large degree, my understanding is, especially from the people with whom I interact, a lot of drug companies make information available on the internet. They even sell particular applications to doctors in order to push information to doctors about medicines, medical devices, or particular treatments. So sometimes that information does come from a credible source dedicated to that particular information, and it's not a bad way to access that information, especially if you're a doctor who's perhaps sitting in a rural area and you aren't necessarily able to access representatives or lectures about medications regularly.
Yeah.
But then again, I suppose the downside is you have to be careful. You once again, you have to use a reasonable approach to what it is that you're accessing on the internet. And I don't think necessarily reports about certain medicines on the internet are necessarily correct. It's all rumor mongering. It might be a matter of somebody publishing information particularly to discredit a particular medicine or a particular drug manufacturer, so one's got to take that into account. But it certainly is, it's a good source of information. It seems to be a broad source of information, but it is not a source of information that you can accept without some degree of checks and balances to make sure that you are happy that what you are looking at is credible.
Okay. So you mentioned earlier that you've seen a rise in the number of queries that are coming through around new media. What in particular are people looking at?
Most people are looking at, I think, the way in which documents move, in the way in which information moves, documents stored, documents maintained. The electronic health record is becoming something that people are talking about all the time, especially in this jurisdiction. Other jurisdictions, Europe, North America, they're looking more now at how you move healthcare information from the healthcare provider to the patient. In other words, remote diagnosis, remote healthcare monitoring, and the movement of that information back from the patient to the healthcare provider. So they're a little bit more advanced. We are looking at electronic health records. Do they have a place here? What place do they have? And how are they relevant to the healthcare environment in South Africa?
Okay, because we're going to be looking at that patient healthcare remote monitoring in our next session, so that'll be really interesting to pick up on that. Neil, I think this has been great. Have you got any parting words of wisdom for our clients when they're looking at engaging into this new media, other than use your common sense?
Well, use your common sense is the best advice I can give anyone who's engaging in electronic media. I suppose the other issue is what do you want electronic media to do for you? What is it that you're trying either to replace, or what is it that you're trying to achieve? Because I think that developments in electronic media and healthcare are very exciting, and I think that the potential for electronic resources and new media to change the way in which we look at healthcare from the traditional doctor-patient consultation is phenomenal, and I think a lot can be done there. But I think a lot more needs to happen when it comes to how healthcare is delivered and who is responsible for that delivery, and what role do they want to play in the delivery of that healthcare.
Absolutely, and I think we'll be having a lot more discussion around this particular topic with you as we move through the year. So thanks, Neil. It's been great chatting to you, and I think that's it from ThinkVisual for the moment. If you've got any comments about what you've seen today, or if you've got any material that you'd like us to convey or to discuss in future sessions, please visit our website www.visuallive.co.za and click on the ThinkVisual tab. We're looking forward to hearing from you, and we'll see you next time.